Hi, I'm Denise Hien, a clinical psychologist by training and professor and director of the Center of Alcohol and Substance Use Studies at the Graduate School of Applied and Professional Psychology at Rutgers University in New Brunswick. My background is in studies of treatments and clinical trials that have been funded by the National Institutes of Health for PTSD and co-occurring substance use disorders. I've spent the better part of 25 years working in this area and doing clinical trials, both national multi-site trials, as well as many different studies of different treatment models in the New York City metropolitan area with urban underrepresented minority populations typically. I'm really excited to film this video in collaboration with the ISTSS production committee for our Fast Facts series. You can learn more about the ISTSS Fast Facts series on the ISTSS website and also social media outlets. But briefly, the production committee is collaborating with ISTSS members to leverage our expertise to create and disseminate important educational materials. This is a second set of our monthly ISTSS Friday Fast Facts, and we'll be talking about an issue that's very relevant to the work that I've just described on PTSD and substance use. We used to think that we had to wait to treat PTSD until people stopped using substances, but research that I and many colleagues across the country and internationally have done now suggests that this is not the case. When PTSD symptoms get better, problems related to substance use also get better. However, when substance use gets better, PTSD does not always improve. So this means that PTSD treatment should not be delayed. And decades of research have shown the strong link between traumatic stress exposure and substance use. So treatments that address PTSD and substance use together have been shown to improve PTSD symptoms without worsening substance use or leading to relapse. As part of this series, on the second and third Fridays, we'll release fact sheets related to PTSD and substance use disorders with the goal of presenting material for clinicians, researchers, and patients. On the fourth Friday, we'll be releasing a podcast where we've assembled a group of experts nationally in the PTSD and SUD field, Dr. Sudi Bak, Deborah Kaysen, Sonia Norman, and I will be talking with the ISTSS production committee chair, Dr. Melissa Zielinski, and committee member Ann Wagner about PTSD and SUD comorbidity, highlighting the important clinical considerations and next steps in research. This podcast will be released on the fourth Friday of the month and will be disseminated on Twitter, Facebook, and the ISTSS website. We're very excited to present this material to you, and thanks for listening.